1. Which of the following is the primary goal of psychiatric nursing? A. To ensure medication compliance. B. To provide emotional support. C. To promote optimal mental health and recovery. D. To manage difficult patients. Two. In the therapeutic use of self, what is a key element? A. Empathy. B. Authority. C. Sympathy. D. Control. Three. Which neurotransmitter is primarily implicated in depression? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Glutamate. Four. When assessing a patient for suicide risk, which factor indicates the highest risk? A. Verbalizing a desire to die. B. Having a detailed plan and access to means. C. A history of previous suicide attempts. D. Experiencing severe anxiety. Five. Which legal document is required for involuntary psychiatric admission in most Canadian provinces? A. Physician's certificate. B. Guardianship order. C. Family consent. D. Police report. Six. What is the primary function of cognitive behavioral therapy or CBT? A. To explore childhood experiences. B. To challenge negative thought patterns and behaviors. C. To provide social support. D. To promote medication adherence. Seven. Which of the following medications is an antipsychotic? A. Fluoxetine. B. Olanzapine. C. Lorazepam. D. Amitriptyline. Eight. The Mental Health Act allows for the restraint of a patient under what conditions? A. If the patient is refusing medication. B. To prevent harm to self or others. C. If the patient is non-compliant with therapy. D. To ensure family safety. Nine. Which side effect is most commonly associated with antipsychotic medications? A. Orthostatic hypotension. B. Hepatic dysfunction. C. Extrapyramidal symptoms. D. Hyperglycemia. 10. What is a hallmark symptom of schizophrenia? A. Low mood. B. Hallucinations and delusions. C. Elevated energy levels. D. Social withdrawal. (11) In a crisis intervention model, the initial step is to A. Define the problem. B. Ensure safety. C. Establish rapport. D. Explore alternatives. (12) Which of the following is an example of a primary prevention strategy in mental health? A. Screening for depression. B. Teaching stress management to school children. C. Offering support groups for caregivers. D. Providing treatment for PTSD. (13) Lithium is commonly used to treat A. Major depressive disorder. B. Bipolar disorder. C. Schizophrenia. D. Anxiety disorders. (14) Which approach is fundamental to trauma-informed care? A. Prioritizing physical health over emotional health. B. Assuming every patient has experienced trauma. C. Using confrontational techniques to address trauma. D. Avoiding discussions about the patient's past. (15) What is the priority intervention for a patient experiencing a panic attack? A. Encourage them to focus on deep breathing. B. Ask them to explain their fear. C. Administer a sedative. D. Call for medical assistance. (16) Which condition is most commonly treated with electroconvulsive therapy or ECT? A. Generalized anxiety disorder. B. Treatment-resistant depression. C. Bipolar disorder. D. Post-traumatic stress disorder. (17) What is a common symptom of borderline personality disorder? A. Grandiosity. B. Impulsive behavior. C. Persistent low mood. D. Rigidity in routines. (18) Which therapeutic communication technique involves restating the patient's words to demonstrate understanding? A. Reflection. B. Summarization. C. Clarification. D. Paraphrasing. (19) What is the primary purpose of a mental status examination or MSE? A. To diagnose psychiatric conditions. B. To assess the patient's current mental functioning. C. To identify physical health issues. D. To plan medication interventions. A patient with dementia displays aggression. What is the first-line intervention? A. Administer an antipsychotic medication. B. Identify and address potential triggers. C. Place the patient in seclusion. D. Ignore the behavior. Which behavior is an example of positive psychotic symptoms? A. Social withdrawal. B. Flat affect. C. Hallucinations. D. Lack of motivation. Which of the following is a principle of harm reduction in mental health care? A. Abstinence-only policies. B. Zero tolerance for relapse. C. Meeting patients where they are. D. Rigid treatment plans. RPNCE. A registered psychiatric nurse or RPN in Canada is a licensed healthcare professional specializing in mental health, psychiatric care, and developmental health. They are trained to address the complex needs of individuals, families, and communities dealing with mental health challenges, substance use disorders, and emotional or behavioral issues. RPNs combine knowledge of mental and physical health to deliver holistic care, promoting recovery and improving quality of life for their clients. Here are 5 top beneficial uses of Registered Psychiatric Nurse of Canada. 1. Holistic mental health care. RPNs specialize in addressing the connection between mental health and physical health, offering integrated care for individuals with complex needs. They assess, diagnose, and treat mental health conditions while considering physical symptoms and social factors, ensuring comprehensive care. 2. Crisis intervention and management. RPNs are skilled in managing psychiatric crises, such as suicidal ideation, acute psychosis, or severe anxiety attacks. Their ability to de-escalate situations and provide immediate, evidence-based interventions reduces harm and prevents hospitalizations. 3. Support for vulnerable populations. RPNs work with diverse groups, including individuals with chronic mental illness, addiction, developmental disabilities, and those experiencing homelessness. Their support helps bridge gaps in care, ensuring marginalized individuals receive essential mental health services. 4. Education and advocacy. RPNs educate patients, families, and communities about mental health issues, stigma reduction, and coping strategies. They advocate for patients' rights, ensuring equitable access to care and promoting policies that support mental health awareness and treatment. 5. Rehabilitation and recovery support. RPNs play a crucial role in helping individuals recover from mental health disorders. Through therapeutic interventions, counseling, and skill building, they empower clients to regain independence, improve quality of life, and reintegrate into society.